Good afternoon, everybody, and thanks for tuning in. John Kelly, and welcome to Thrive. Today, we're going to be doing some education, and I'm going to be talking a lot about a pretty hot topic, and that's understanding addiction in the family. If you like what we're talking about here, please send us a like, and please subscribe if you're interested in the topic, or you have a loved one or good friend or anyone, relative suffering from any kind of addiction. Addictive illness is really a killer out there today. There's no question about it. And also, please feel free to comment. We love your comments. We can't get enough of your comments, so feel free to comment. I would like to start off by telling you I was an extremely bad addict. I had a severe case of addictive illness, and that went on for a number of years and really almost caused my self destruction. But I got into recovery, I got back on my feet, and away we go. And today I'm going to be giving you some insight based on my 30 years in the addictions field. I started off as a counselor and worked my way up to executive director of a major outpatient counseling center in New Jersey. I first came up with the theory of low self esteem at the beginning of addiction. I researched it and came up with it. And that was my first book, Warning Signs, a guidebook for parents. And that's out there. It's 20 some years old now, but I'm very proud of it. So that was my first book. And now my second book is Discovering Lazarus. And this is a book about the good, the bad, and the ugly of John Kelly. And it gets into how I went from addictive illness and being an addict and being on the street and moving myself up and ending up on the Lee Brown Clinton Committee back in the early 90s for the drug strategy for the United States. Discovering Lazarus. I think you'll find it very interesting. Got a lot of good feedback on it. And this is the whole story right here of John Kelly, addiction specialist. So this is how I started. This is where I went. And then eventually I started to look at serial murder. And as you can see, I'm very much a researcher. I like to look into things. I like to pull things apart. So I started to look at serial murder. And I was the first person to bring out that serial murder was an addiction. And it's in this book, Discovering Lazarus. That's how I ended up going into profiling. So lots more to be said on that. But my focus today is just on substance abuse, addictive illness in the family, and how do you survive it? That's the most important thing. How do you survive it? And that is going to be next week. Next week, we're going to talk about what to do if you have addictive illness in your family. I'm going to give you some suggestions. Ultimately, it's up to you if you follow through or not. But I will give you my experience of over 30 years on what to do and let you take it from there. You're the boss. You're the one that's in control of your life and your family. There's no question about it. So that will be next week on how to. Today, we're focusing on how to understand it. Because if you don't understand it, how the hell are you going to take care of it later on, right? So by giving you an understanding, you will learn next week what to do. All right. So thank you very much for tuning in. And now I've got to talk to my producer and major questioner. Who she's great. She's very smart. She has a lot of good questions. And here's Leah. Leah, how are you?
Good. Hello, John. Thank you for having me on. Appreciate it.
Sure.
All right. So let's get into this here. Um, as you mentioned, John, today we're just talking about understanding addiction in the family. So can you tell me, John, what is addiction? Okay, we talked about it before as a disease. What is that?
Yeah, I look at it as a disease. If you look at the definition in the dictionary, a disease is anything that causes any kind of upset to an organism, to any kind of organism. It can be a plant, it can be an animal, it can be human, whatever. Disease is a disease. It's a self-destructive process that starts to take place with any kind of organism. And that's the way, pretty much the way it's been defined in the dictionary. It's a very, very self-destructive kind of situation that goes into process. And if it's not treated, it can really rake hell with you. And I look at addictive illness as a disease because that's what it does. It starts to destroy another human being, and really, the bottom line is that it will eventually kill you if it's not treated.
Right. Okay. So, John, can you tell me more? What is the difference between addictive illness as a disease and other diseases?
Well, that's a really good question because, with any other disease, pretty much, a family can get involved and a family can help their loved one get help, get treatment, take care of them, get them to a doctor, get them to a hospital. And in most cases, their loved ones are going to listen to them. For instance, if they have diabetes or if they have cancer, which are diseases as well, But with this disease, it's so different because trying to help care for and enable your loved one to get help can really backfire because this disease, in many cases, the addiction itself wants to be fed and really is not interested in getting into treatment or getting help. It's just interested in picking up its drug, whatever its drug may be. It's kind of like you're dealing with a uh, uh, a hunger inside of you that's crying out and doesn't want to be stopped from picking up its drug of choice. And that can be a meth addict, a heroin addict, an alcoholic, a benzo addict. I mean, it doesn't matter, whatever the substance is. I mean, addiction can really be a very hungry lion living inside of you and is not interested in getting treatment or getting care. So that's why a lot of loved ones can run into a roadblock when they try to help the addict in their family because he may not want it or she may not want it or they know better. The addiction, as I said, is a disease. The disease uh, has a paramount order, if you will, to continue to use and to self destruct. And if not intervened on, they will self destruct. There's no question about it. But the funny part about this disease is it's the major way to help it is through self-help. The person has to help themselves. They have to want to get better and they have to want to follow through. Um, it's very, very uh, against the way we were raised, against everything we knew growing up. When people are sick, they usually look to go to a doctor. They look to get well. They look to go to a hospital, whatever they need to get well. But with this disease, it is hell bent on self-destruction, and it's not easy to help a loved one that has that is suffering from addictive illness. It's very hard, unless they
Mhm.
want it. But again, that goes back to the self-help. They got to want it.
Right. So, John, can you tell me about the transformation that happens with somebody who's suffering from addictive illness as they progress with the disease?
Yeah, the transformation takes place. I call it like a Dr. Jekyll, Mr. Hyde transformation. And they go from somebody that they used to know in the family, that had some feelings, that cared, that was on their game. And all of a sudden, this transformation takes place to like this this Mr. Hyde character jumping from Dr. Jekyll to Mr. Hyde. And it's like, who is this person who's acting so irrational, who's not listening? I mean, this isn't the person I used to know. I mean, they've just made a complete jump, you know, in with their personalities. I mean, they're starting to do a lot of negative things. They're starting to do whatever they have to do to feed the addiction. Maybe they're lying, cheating, stealing, whatever they have to do. They've taken on like this antisocial kind of personality, which they never had before. But this is how strong the addiction is and how it just consumes the individual and overtakes them. And in many, many cases, um, they're going to continue to do what they do to feed that addiction. And all of a sudden, other loved ones and friends and family are saying, who is this person? I don't even know who this person is. So that's the difference with the normal disease. And this is the transformation that can take place with addiction. It's like you're living with another person who you lived with for 20 years, but you never knew or something. Goes from Dr. Jekyll to Mr. Hyde.
Mhm. Right. So, what happens, John, if a loved one tries to intervene with this person?
Usually, when a loved one tries to intervene with some type of help, usually counseling or rehab, there's going to be backlash. Okay. The addict doesn't want it. They think they can do it on their own or whatever. But that's usually the disease itself, the addiction talking, and leading the addict to believe that they don't need any kind of counseling, they don't need to go into rehab. And really, that's about, the addiction raising its monstrous head and saying, look at, what you do is you need to stay out of rehab, stay out of counseling, because, we want to get high. We want to pick up some more drugs. I mean, it's in their head. They don't need the help, but yet they can do it themselves, but yet they will be the first ones to go out and pick up, their drug of choice and keep the scenario going, the self-destructive scenario going. So this is something that's very, very, very important to realize. So you can run into a lot of backlash, and I think it's important for you to realize that this is a symptom of the disease. Everything we're talking about here, in the negative with this loved one that you care about, is a symptom of the disease. Okay. Most diseases do not have this symptom. Okay. Where the patient is going to give you backlash, or your loved one's going to, strike back at you because they don't want help. Most people want help to help cure the disease, whatever it may be. Like we said, cancer or sugar diabetes or whatever the disease may be. So yeah, it's like dealing with a different personality, but that's brought on by the disease, the addiction, because the substance abuse is stimulating various brain chemicals for the person to get high, but then it's depleting them, okay, and which is causing you not to have as many brain chemicals or neurotransmitters you had before you started using. So that will cause you to have a different personality, and could cause you to become very angry and do some crazy irrational things as well. That's what addicts do. Those are symptoms of the illness. No question about it.
Mhm. So, can you walk me through the thought process and thinking of somebody who's going through addictive illness? Who's really making the decisions?
Yeah, really, it's like this internal uh, critic person. It's somebody. It's if somebody's possessed. You know, that's like really who's making the decisions. and it's the disease. It's the addiction. Okay. I mean, that's who's really calling the shots, you know? And once you become addicted and that addiction starts to take over and call the shots, you don't have to think anymore. You don't think anymore. You don't have to think anymore because that addiction is going to tell you what to do. It's going to tell you what time to get up, when to go to sleep, when to eat, when to have sex, who to hang out with. You know, I mean, it's going to completely control your life, and that's what addiction is: a loss of control. You've lost control.
I like that. It's a good definition. So, John, do insurance companies help people in this situation?
Well, see, this is the thing, and this is why you know it's a disease. Okay, because insurance companies do not pay for bad people to get good. And lots of times people are looking at the addict and they're saying, "Oh, he's bad. He's bad. He's just really, a bad person. He's just, gone. It's all over for him. He ran bad." But the bottom line again, if you realize that it's a symptom of the disease, you have to understand that insurance companies, again, do not pay for bad people to get good. They pay for sick people to get well. So, because insurance companies pay for this, they're accepting and realizing that it is a disease and it does have a diagnosis. Okay, that's why insurance companies pay for it. Insurance companies don't pay bad people to get good. They could go hang out at the jail all day and with some pretty heavy duty criminals, but insurance companies aren't paying for criminal activity. They're paying for diseases and they're paying for diagnosis.
Okay. So, can you tell me, John, who is affected by addictive illness? Who does it target?
It targets everybody. It does not discriminate. Addictive illness does not discriminate. It targets everybody. And what I mean by that is anybody can become addicted. Okay. I mean, we say from Yale or jail. Okay. I mean, it doesn't matter where you're from. Okay. You can come down with addictive illness, just like you can come down with diabetes, or you can come down with cancer, or you can come down with some other disease. It doesn't discriminate. Okay. And I mean, if we just take a look at it, I mean, we can look at some, various singers over the years, famous singers, um, that have had addictive illness and have died from it. Okay, we can look at Jimi Hendrix. Whoops. We can look at Janis Joplin. Okay, we can look at Weinstein. What's her first name?
Um, Amy Weinstein.
Amy.
Winehouse. Winehouse. Winehouse.
Yeah, White House. White House.
Winehouse.
Winehouse. I'm sorry. So Amy Winehouse, beautiful, talented, young singer, died from addictive illness. Okay. And whatever side effects came from addictive illness, because you carry a lot of anxiety, depression, post-traumatic stress with you, that those are also symptomatic or can be symptomatic, of addictive illness. And then you take a look at various actors we've had. I mean, it's just amazing when you take a look at it. We had John Belushi from Saturday Night Live. We had what was Mr. Downey Jr.'s name?
Robert Downey Jr.
Robert Downey Jr., I believe. I mean, he is alive and well, thank God. But he suffered with a bout and he's surviving and went into a great recovery from addictive illness, right? And, we're also looking at that fellow, what's his name from Friends, recently passed away, Matthew Perry. Mm-hmm. Matthew Perry passed away from addictive illness, okay? So, I mean, you can have addictive illness, you can go into recovery, you can relapse. Lots of times relapse is part of recovery. Not everybody hits it out of the park the first time up the bat. They take it in slices. I've seen people go for years and then relapse and pick themselves up and carry on. I mean, just because you have a relapse doesn't mean that you've lost everything you've learned in all those years you were recovering. That's all BS. Okay. If you get back on the train to recovery, you're doing the right thing. No worries, you'll continue. It's when you relapse and get off the train and then you continue your relapse and you don't get back on the train to recovery. That's, when it starts to go downhill. People trip, people fall, people get up, and people move on. And that's the key, to keep moving on. Okay. As I mentioned a time or two before, addictive illness can be a very, very cruel master when it has you enslaved.
Hmm. For sure. So, John, pretty much one more question for you. What do you say to family members that may think that their loved one is maybe too smart to be dealing with this or too intelligent, that they might just think, hey, this person's smarter than this. Why are they going through this addictive illness?
Yeah, intelligence has nothing to do with disease. I mean, extremely intelligent people end up with diseases, and addictive illness is a disease. It's that simple. Okay. I mean, let's take a look at, some of the politicians that have had problems with addictive illness. I mean, we can take a look at uh, Betty Ford. Okay, Betty Ford, President Ford's wife. She had a rough case of addictive illness, turned it around, got on that train of recovery, and really kicked butt. Okay. I mean, she opened up some really great rehabs, really great treatment, and a lot of it was on a cutting edge of treatment for this disease. So I really, really and truly applaud her. Then we've had a governor or two, I think of Mr. Hughes, am I correct?
Hmm. Harold Hughes?
Harold Hughes. I mean, he did a lot for the addictions field. He's a recovering, or was a recovering, I don't know if he's still alive, congressman and senator. So intelligence really doesn't have a lot to do with this. I mean, you see it with, in fact, we said, like I said in the beginning, Yale or jail. I mean, I've seen doctors suffering from addictive illness. I've seen lawyers. Um, we've seen it all. We've seen priests. We've seen rabbis. Um, we've seen actors. We've seen great singers, producers. It can grab anybody. Major announcers, major television announcers, very smart people, very smart people. But smart lots of times has nothing to do with this, because once it takes you over, it leads you to believe you're the smartest one in the room. You know what's best, even though you're self-destructing. It's like you become an egomaniac involved in a self-destructive process, like an egomaniac with an inferiority complex. I mean, it gets really, really, really crazy, but it's that complicated. It is very, very, can be a very, very complicated disease because it goes against every other way that we treat diseases in the United States. I mean, the method of madness is just, out of this world.
Hmm. Right. Well, John, I really look forward to hearing what you have to say next week on,
Yeah,
how
because
to
this
help.
is it. We had to put a foundation down here before we can build on it. I
Hmm.
mean, like a family house, you have to have a foundation before you can build a family house. Right? So we've got a foundation of understanding, and next week we're going to be focusing on what to do, how to do it, how to survive and what to do for your loved one, even though they are extremely resistant. Okay, so until next week, I want to thank you. And of course, I'll talk to you before then. But I want to thank everybody. I want to, you know, really thank our audience today. I really appreciate you tuning in. And it's very important that we get a hold on this. It's destroying the country. And it starts by destroying the family. And if you think about it, the family is the foundation of the country. The country, I'm sorry, the family was not built on the country. The country was built on the family. Remember that. The country was built on the family. So the strength of the family is the cornerstone for the United States. And that's what we need. We need that strong family foundation to move forward with this. So anyway, thank you all. I truly appreciate you all tuning in. And until next week, God bless. Take care of yourself and see you soon. Thank you.
Thanks, John.